You can see the parietal bone, which is the left parietal bone and the right parietal bone. You see the sagittal suture going right down the center, okay, between the two parietal bones. You see the lambdoid suture. Lambdoid suture goes between the parietal bones and the occipital bone. Temporal bone is below the parietal bones on the side of the skull. Occipital bone, okay, is the most posterior bone of the skull. You have an external occipital protuberance. That's at the point of the occipital bone that sticks out at the back. And around that protuberance, you have the superior nuchal line where the muscles attach to the back of the neck and allow the neck to move, the skull to move. Okay. You have the occipital mastoid suture between the occipital bone and the mastoid process. Okay. And these lines here are examples of what's called sutural bone, where bones fuse together and join. That's called a sutural bone. And we have the parietal bones. Okay, this is male and female pelvises. Looking at the front, remember the top portion is your ilium. This is the iliac crest. You see the dashed line on both sides. You can see the iliac fossa, which is below the crest where muscles attach. You see the pubic tubercle, which are extensions of the bones that stick out. The acetabulum, okay, is the hip joint. That's where the head of the femur articulates, okay, with the pelvis. You see the pelvic pubic symphysis, which is the junction of the two ischium bones. Okay. You see the pelvic angle just below the pubic symphysis. If that angle is less than 90, it's male. So on the left side, that's a male skeleton. On the right side, it's greater than 100. That's a female skeleton. So we can tell. Okay, on the ischial bone, we have the ischial tuberosity. Then going down your vertebral column, you have your sacrum. Okay, this one you can see the sacrum. On the one to the right, you can see the coccyx just below it. And that's the end of the vertebral column. Okay. And then you got your obturator foramina, which is the opening, okay, in the ischium bone. Okay. Okay, the thoracic cage. You have the first rib. You can see all 12 ribs. Ribs 1 through 7 are called what?
True.
They're called true ribs. Why?
Because they actually connect to the sternum.
Because they connect directly to the sternum. Ribs 8 through 12 are called what?
False ribs.
False ribs. Perfect. Because they don't connect directly to the sternum. They connect to the 7th rib, which then connects to the sternum. They have no direct connection to the sternum. And ribs 11 and 12 are called?
Free floating or floating ribs?
Perfect. Floating ribs. Okay. Because they have no connection out of the sternum. The costal end does not end in the sternum. Perfect. So you see rib number 1 up on the top there, from the first cervical vertebrae extends from. Then you have the sternum, which is composed of the xiphoid process, which is the most posterior tip, the body, which is the middle, the manubrium, which is the top part, like the plate, and then the jugular notch on top of it. Okay? Then you have costal cartilage of your true ribs, where the cartilage forms and connects directly to the sternum. Okay. The computer catch up. Okay, lateral view of the skull. You have the temporal bone and the mandible. Let's look at a couple of interesting things here. What's this bone above the temporal bone? Where that gray dot's going?
Parietal?
Parietal bone, perfect. And this is the
Frontal?
Frontal.
frontal bone, got it. And this is the what?
Occipital?
Occipital bone. All right. And look here, I'm going to blow this up. Let's see if I can blow this up bigger. You can see the skull. You see that tooth? You see all that bone destruction around it. See how the bone's been destroyed? That's an abscess. Oops, I lost my screen. Okay, you can see when an abscess occurs, it destroys the bone and makes the support part of the tooth. That's what caused the teeth to come out. Not much was holding that tooth in. That tooth would be kind of flowing in the wind when the person talks, if they're still alive. Because that's periodontal disease. That's where the bone's been destroyed. You can see all the destruction that an abscess can cause. All right. This is the clavicle and your scapula. This is the joint between the acroclavicular joint. So this is the spine right here. We'll label that. That's the spine of the scapula. Then you got a supraspinous fossa on the top, and you got a subscapular fossa below that for muscle attachments. And on the clavicle, you have two ends. You have a sternal end where it connects to the sternum. And you're going to have a acromial end where it connects to the acromion of the scapula. Okay, this is the shaft of the clavicle, the length of it. This is a coracoid process behind in the scapula. This is the acromial end we talked about, the other end of the clavicle. And this is the acromial clavicular joint, where the acromial end of the clavicle meets the acromion of the scapula. And that's your shoulder joint. So there's three bones that make up the shoulder joint, or the pectoral girdle. They're the clavicle, the scapula, and what else?
The humerus.
The humerus of the arm, perfect. Those three bones make up the shoulder joint. Okay. Okay, so this is the elbow joint. Okay, this is the humerus bone coming straight down here. And on the humerus bone, you have your coronoid fossa. You have a medial epicondyle on the humerus. Then it's two divisions where the ulnar and the radius fit into. It has the trochlea. This is the trochlea right here, that blue area. The trochlea is where the ulna fits in. And there's a capitulum. You have a trochlea and a capitulum. The trochlea where the ulna fits in. The capitulum is where the radius fits in. Okay, so a trochlea and a capitulum. Okay. You've also got a coronoid process of the ulna, which articulates. This is the ulna here on the right. Then this is the radius to the left, and it has a radial tuberosity and outgrowth of bone. And then you got the head of the radius, which articulates with the capitulum. And then you have a radial fossa on the humerus. Right. So far, so good. Okay, different view of it from a different angle on the side now. This is the posterior view. Again, you're looking at this, and it's looking at the back of it here. This is the medial side. Okay, so it's a medial epicondyle of the humerus. You also have a lateral epicondyle, which you can't see. Oh, there you can see a little bit of it. There's a lateral epicondyle of the humerus. Lateral means away from the midline. Medial means towards the midline. Okay, you have the head of the radius. Now the radius fits into the capitulum, right, of the humerus. And you have the olecranon of the ulna as it comes up to the top. Okay. Then lower on down the arm, we have, let's start over here. Let's have the radius and the ulna. You have your radius. The radius is on the same side as the thumb. In the anatomical position, the radius is on the lateral portion of the lower arm. Okay, so there's the radius. You have the styloid process of the radius, which is the kind of little horn that sticks out there in the radius. Then you have bones that make up the inner part of the hand. Let's see if I can get that a little bit bigger. Okay, you have the trapezoid. You have the trapezium. Okay, we got metacarpal 1. Remember, the metacarpal bones are labeled 1 through 5, with the phalanx or the thumb being number 1, then 2, 3, 4, 5 is your digits. So the metacarpal bones connect the bones of the hand to the phalanges. Okay, so this is metacarpal 1. Then coming across, you have phalanges of digit 1. Okay, the phalanges of the phalanx, it only has a proximal and a distal phalange. You get the thing on, you can see there's only 2 bones here. Okay. The metacarpal bones, the phalanges of the other digits all have 3. They have a proximal, a middle, and a distal. Let's move this up. And then we got the capitate bone in the hand. This is a proximal phalanges of digit number 3. Again, it has a proximal, it has a middle, and it has a distal. Okay, so there's the middle phalanges of digit number 3, and there's the distal phalanges of digit number 3 and the middle phalanges of digit number 3, then the proximal. Okay. And those make up the phalanges. This is the phalanges of digit number 5, which consists of 3 bones, proximal, middle, and distal. You got metacarpal bone number 5. Okay, that's the bone to the little finger. Then the other bones of the hand, you have the hamate, you have the pisiform, and triquetral bone. Okay. You also have the lunate. You can see where they're highlighted, and the scaphoid. All make sense? Let's go with. Okay. See the same bones again. You can see the ulna. The ulna is always the larger bone on the 2 also. It's always on the medial side of the lower of the pinky finger. So there's your ulna. There's a styloid process of the ulna, a little hook or extension of it there. Then you have the lunate, triquetral, hamate. Those are the bones of the hands, 3 of the bones of the hand. You get your metacarpals. Okay, metacarpals 1 through 5, where number 1 is the phalanx. And then the 4 digits in order. Then you got your phalanges. Then you got your capitate bone, trapezoid bone, and your trapezium bone, and your scaphoid bone. Then on this extension here on the radius, you have the styloid process of the radius, which is just an extension. There's like the styloid process in the skull. It's like a little hood that comes out. It's an extension of the bone. You have one on the ulna and the radius. And then this is your radius bone. What connects the radius and the ulna together?
Intraosseous membrane.
The intraosseous membrane prevents movement between the two. They can't move independently. Perfect. Okay, in the thoracic cage, you do have your clavicle, your collarbone. You have the coracoid process of the scapula. Okay. And that's just behind the acromion right here. The acromion is the bone right there where it comes up. That's the most anterior portion that forms the shoulder joint. You have the sternum. Again, the sternum has three parts. It has the xiphoid process, the body, and the manubrium. You have the costal cartilage of the true ribs. So that's ribs 1 through 7. And then you have costal cartilage of the false ribs. Ribs 8 through 12 of the false ribs. But there's no costal cartilage on 11 and 12, since those are free floating ribs. So you only have costal cartilage of false ribs numbers 8 through 10. Again,
Doesn't costal mean rib? Doesn't that indicate that it is a rib?
That indicates it is a rib, right? Because the costal fossa of the ribs, the intercostal muscles, yeah. Intercostal muscles, muscle between the ribs. Yep, costal refers to ribs. The cartilage is where they attach. Then you see T12, thoracic vertebrae number 12. That's where rib number 12 comes off of. You see rib number 11, that's T11, that's rib number 11. You see rib 10, which actually connects to rib number 7 through cartilage. Then ribs 9, 8, 7, 6, 5, 4, 3, 2, and rib 1. Because rib 1 connects to C1, rib 2 connects to C2, and so on. And you have the acromion process of the scapula. Rib number 1 is up there, and the clavicle. Perfect. Okay, look at the posterior view. You can see the clavicle. There's a collarbone. You see how it runs between the sternum and the scapula, the acromion process of the scapula. There's your scapula below that. These are your floating ribs, numbers 11 and 12. So that's T12. L5 is your fifth lumbar vertebrae, last lumbar vertebrae before the sacrum. So you got C1 through 7. How many thoracic vertebrae do you have?
12.
12, one for each rib. So C1 through 7, thoracic vertebrae T1 through T12, L1 to L5, then the sacrum and the coccyx. Make up your spinal cord. You can see your false ribs because they don't connect directly to the sternum. Those ribs 8 through 12, I'm sorry. And your true ribs 1 through 7 that connect directly to the sternum. And then you can see T1. What's another name for T1?
Atlas and axis.
Which one's T1 though? You got a 50-50 chance.
Atlas.
Atlas, perfect. T2 is the axis. Those are the vertebrae with those are only two vertebrae with special names. T1 is the atlas. T2 is the axis. Okay, the rib that articulates with the vertebral column. You can see the angle of the rib, which is where the rib bends from around the body of the rib. You can see the tubercle of the rib, the extension there, coming off the rib. The transverse process, okay, is what comes off of the transverse process that connects to the spinal cord. Okay. Your transverse process always runs to the sides. Your spinal process always runs posterior. So this is the transverse costal facet, where the vertebrae stack on top of each other. This is the superior articular process. That's where the inferior articular process of the vertebrae above it articulates with it, comes down on it. You have the head of the rib that attaches to the thoracic vertebrae. And you have the neck of the rib. So you have the head, the neck, the body, then the angle and the tubercle, all of the rib. All right, pelvis again. Male and female. The female is on the right. Okay, the pelvic angle is greater, but you can't really see a pelvic angle there. But you see the coccyx bone. Coccyx bone, look at the difference. You know, on the male, you can see it's very short. And because that, the female bends back away from the birth canal. So the baby doesn't hit the coccyx during childbirth. On the ilium, you have the anterior spine, the anterior superior iliac spine, sorry. You have your anterior superior iliac spine. You have your iliac crest, which runs across the ilium. You have the greater sciatic notch, where the sciatic nerve runs. Okay. You have the posterior inferior iliac spine. Okay, just below the anterior superior iliac spine. You have the sacrum, part of your vertebral column, and the coccyx. You have the ischial spine, and you have the ischial tuberosity. And the acetabulum is where the head of the femur articulates with the pelvis. Okay, here's your hip joint. You can see the hip bone. That whole mass is the bone there. This is the articular capsule. This is a synovial capsule filled with synovial fluid that allows this joint to move in all directions. So the articular capsule is the outer capsule of the synovial joint of the hip joint. And this is the femur bone. And the head of the femur bone articulates with the acetabulum of the pelvis here. So you got the hip bone, you got your articular capsule surrounding the joint, and you got your femur bone. All right, again, you can see the hip bone. You can see the head of the femur and the neck of the femur. There's your head. Again, a head articulates with the acetabulum of the pelvis bone. You have the neck of the femur just below the head. You have the greater trochanter. You can't see the lesser trochanter. It's on the other side. That's blocked your vision here. And yeah, this is the femur bone. The entire thing is the femur. Okay. All right, a little more detail there. You have the acetabular labrum, just like you do in the shoulder. The labrum is the tissue or the lining, the lining pad that surrounds the joint. A lot of times that's what gets damaged in shoulder injuries or hip injuries. So the acetabular labrum is a lining around the acetabulum. Right? You have the synovial membrane. There's a membrane that surrounds the joint on the inside that allows it to be filled with synovial fluid. So the hip can rotate freely in all different directions. You see the head of the femur. You see the greater trochanter of the femur and the lesser trochanter of the femur. There's your greater, there's your lesser. Okay, this was the neck of the femur and the head of the femur. Okay, and the head of the femur articulates with the acetabulum as part of the pelvic bone. That's where the head of the femur fits into, the socket it fits into. Okay. You have articular cartilage inside the acetabulum. The cartilage is there to prevent bone rubbing on bone. Okay. So cartilage rubs against cartilage. It allows for a smoother rotation of the hip joint. Again, you have your synovial membrane that surrounds the synovial fluid. You have your acetabular labrum, which surrounds the acetabulum, is the outer coating around it. And you have the acetabulum, which is the entire fossa or depression where the head of the femur fits into. Okay. Okay, this is your knee joint. So this one. This is the outermost layer. You can see the medial condyle of the femur. Is there a question? You still good?
Yeah.
Hmm?
Okay.
Papi.
You can see the medial condyle of the femur.
Yeah.
You can see the medial meniscus. The meniscus is the cartilaginous pad between the.
I'm trying to freaking
Tell
use
the
my
mic's on
charger
now.
appointment.
There we go. That should be better. Okay, the medial meniscus, okay, is the pad between the femur and the tibia and the fibula. Okay, it's a pad that allows the bones not to make direct contact with each other and allows for a smooth function of the knee joint. You have a medial meniscus and you have a lateral meniscus. This is the medial side. Okay. You have the medial condyle of the tibia and the medial collateral ligament. You see how the whole thing's on the side. You have a medial collateral ligament and a lateral collateral ligament that extend from the outsides of both from the femur to the tibia and then the femur to the fibula on the other one. Okay, so that's a medial collateral ligament running along the side. And then you got the patellar ligament. Patellar ligament connects the inferior border of the patella to the tibia. Okay. And we got the head of the fibula. And here's your lateral collateral ligament. So the medial collateral ligament connects the femur bone to the tibia. Yeah, okay. The lateral collateral ligament connects the femur to the fibula on the sides of the knee. That helps prevent injuries for the knee rotating. You have the lateral condyle of the tibia. Then you have the lateral meniscus. Performs the same function as the medial meniscus. You have the lateral condyle of the femur bone. And you have the patella, which is your kneecap. And connecting the kneecap to the femur is a quadriceps tendon. So you have two tendons that connect the patella. You have the quadricep tendon, which connects it to the femur. And you have the patellar ligament, which connects it to the tibia. Those two tendons hold the patella in place over the knee for protection. Oops, what did I? Okay. Now they've taken the patella and they've cut the quadriceps and flapped it down. So this section here, where my mouse is moving right down in here, belongs up here. That's where it's attached to. Okay, so they've cut it here and reflected it down to see underneath it. And underneath it, you can see the ACL, the anterior cruciate ligament. You can see it enters between there, runs around the back, and wraps around the side. I said when you have a twisting movement of your knee, when it twists how it's not supposed to twist, like in basketball, like in skiing, when the knee twists, that's the ligament that gets damaged. Okay, because it's the one that goes around the knee when it twists. When the knee twists, it turns that ligament and rips it. That's your ACL. And you can see your medial meniscus between the bones or the joint. And you see your medial collateral ligament. And this is the quadriceps tendon that's been cut and reflected down. Now, remember, the quadriceps tendon attaches to the femur bone up top. So it's been cut off the femur bone and reflected down so you can see. And the patella has been pulled down also, because the patella, which is here, goes right here up in this area, over the middle of the kneecap. So this is your patella, and this is the patellar ligament. Okay. Then you got the head of the fibula. You got the lateral meniscus, and then you got lateral collateral ligament. Okay. And then you got the patellar surface of the femur, where the patella goes over that area. That's where the patella bone fits over, if it wasn't cut and reflected down. Okay, again, it's still cut and reflected down. We're still looking down. You get a little bit lower, deeper into it now, a little dissection. You have the PCL, which is the posterior cruciate ligament below the ACL. You got the medial condyle of the femur. You got the medial meniscus. And then you got your ACL. Okay, so there's the ACL running down below. There's a PCL running above it. And there's your anterior cruciate ligament as it dies down between the kneecap and wraps around the back. That's your medial collateral ligament and your quadriceps tendon, which has been cut and reflected down. Your patella has been cut and reflected down, and the patellar ligament holding that together. You have your lateral meniscus. Again, same as the medial meniscus, just on the other side. Okay, then you get your lateral collateral ligament. And you got your lateral condyle of the femur. Okay. Those are the three different depth layers of dissection for the knee. This is the medial, if you look at the medial side of the knee. Okay. You get the medial condyle of the femur. As it comes down, you got the medial collateral ligament. Again, the medial collateral ligament connects the femur bone to the tibia bone on the side of the knee. And you're looking straight at the side of the knee now, the medial side. And you get your medial condyle of the tibia. Patellar ligament. This is the patella bone right here. And this is your patellar ligament that holds on together. And then you can see the medial meniscus, that thick pad between the articulation of the two bones. Okay, let's see if we can advance this. Oops, I think I went one too far. Here we go. Okay, looking at the back of the knee. Yeah, let's take a look here. You can see the lateral condyle of the femur. You can see the lateral collateral ligament, again on the side there. You see the lateral meniscus, which tells you the movement of the joints, which everything moves smooth. You can see the lateral condyle of the tibia. And from under that, you can see the head of the fibula. You can see the PCL ligament as it came from the anterior part back.
Posterior cruciate ligament.
Why did I do that all of a sudden?
I think
Okay.
you clicked on it.
Yeah, I don't know why I did all of a sudden, just said the names. I must have clicked on it. You can see the medial. So this is your PCL that ran from the anterior portion back behind, pretty straight. Remember, the ACL goes the same way below it, but it wraps around. Okay, so this is your PCL. You have the medial condyle of the tibia. You have your medial meniscus, your medial collateral ligament, and your medial condyle of the femur. Okay, lateral view. Lateral view, you have your this is your patella still. This time it's not reflected down. So you have your quadriceps tendon, which connects the patella to the femur bone. You have your patellar ligament, which connects the patella to the tibia. You have the lateral condyle of the tibia and the lateral collateral ligament. Okay. You have the head of the fibula on the side. You have your lateral meniscus and the lateral condyle of the femur. Okay. Looking at the femur bone and the patella. This is your patella. This is your kneecap. The apex, it's like almost like a heart shape or a triangle. And the apex is the very tip that you're looking at right there. So it comes like a heart shape, like at the base of the heart. That's your apex. You see it better if the patella gets flipped up. Okay. So there's your patella and your apex. This is the medial condyle of the femur and the medial epicondyle to the very side. This is the lateral epicondyle and the lateral condyle of the femur. And the space here is your intercondylar fossa. Okay, the space between the condyles, between the medial and lateral condyles. Okay, this is a little bit better view. Still looking at you. This is the apex of the patella. This is the patella bone. Your apex is the tip, where it comes to the tip of the triangle. And again, on your femur bone, you got the lateral condyle, and to the side of that, you have the lateral epicondyle. You have your medial condyle, and to the side of that, you have your medial epicondyle. Okay. You have your adductor tubercle, where the adductor muscle is attached to move the joint. And then right here, this is the intercondylar fossa between the two condyles, between the medial and lateral condyles. Okay. And then this is the bones that go down the lower part of the leg. You can see the patella. You can see the tibia bone. This is the large one here. And the fibula. So there's your patella. There's your proximal tibulofibular joint. Okay, so if you look at this, there's two places where the tibia bone and the fibula bones meet. This is the proximal end, which is closest to the femur. Okay, so this is a proximal tibiofibular joint. And down here, you'll have a distal tibiofibular joint, which is farthest away from the femur. Okay? And also between the tibia and the fibula, you've got an interosseous membrane, okay, that holds them together. Okay. So that was, again, the patella, the proximal tibiofibular joint, the medial malleus, which is an extension of the tibia. You have the metatarsal bones, just like the metacarpal bones of the hand. These are metatarsal bones of the foot, and the phalanges. And the same rules apply for the phalanges of the foot as do for the hands. The hallux, or the big toe, has only 2 phalange bones. All the other digits have 3 phalange bones, a proximal, a middle, and a distal. The hallux only has a proximal and a distal. Okay, the large bone in the foot right here that connects it to the tibia, that bone right there, that is the talus bone. Okay. Let's see what else. And we have the lateral malleus bone here. And then you have the distal tibiofibular joint. Again, there's 2 joints, one proximal, one distal, where the tibia and the fibula meet. Okay. This is looking at the medial side of it. So you can see the patella. You can see the medial condyle of the tibia. You can see the fibula, which is behind the tibia there. You can see the medial malleus of the tibia. Again, the bones here, we'll enlarge that a little bit. The large bone that connects to the tibia coming down, okay, at the medial malleus is a talus bone. And your heel bone, your heel bone here is called your calcaneus. It's the large bone of your heel. In front of that is a navicular bone. And then we have the distal phalanges and a proximal phalanges. And then we're looking at the hallux there. There's only two bones of the phalanges. This is metatarsal 1. Again, it's numbered the same. The hallux is going to be metatarsal 1, the one that connects to the hallux. And all the rest of the digits are labeled phalanges 2 through 5. Okay. You have a medial cuneiform bone also, on the medial side, and an intermediate cuneiform bone. And on the other side of that is a lateral cuneiform bone. You have the shaft of the tibia. So this is the entire length there, and then you have the patella. All right, look at the posterior view of it. You can see the patella bone sticking up in the back right here, just the tip of it. You can see the tibia condyles, and you can see the head of the fibula. You see the lateral malleus, where we are, of the fibula bone. And again, the large bone that connects between the tibia and the foot is a talus. Calcaneus is your heel bone. Again, you're looking at the back of your leg. Okay, so that's your calcaneus. Metatarsal 1, the medial cuneiform, the medial malleus of the tibia, and the navicular bone of the foot. And one more slide. If it pops up, there it goes. Man, this is a lateral view looking at the side of it. You can see the patella. You can see the tibia, bones of the foot. You see the intermediate cuneiform. You see the medial cuneiform to the medial side, and the lateral cuneiform to the lateral side. You can see the phalanges, the metatarsal bones, and the cuboid bone of the foot. Have the calcaneus, which is your heel bone. You have the talus bone in the foot that connects to the tibia. You have the lateral malleus portion of the fibula. You have the navicular bone. You have the shaft of the fibula and the head of the fibula. That's what you're looking at the lateral view. Okay, any questions so far? We'll run through the quiz, and then we'll do chapter 12. I'm caught up with everything. All right, no one should miss this one. Which bone is highlighted? Mandible, temporal, sphenoid, or maxilla?
Mandible.
Mandible.
Mandible. All right. Okay. What structure is highlighted? Now remember what's flat down out of the way.
Patellar surface of the femur.
Perfect. Patellar surface of the femur. Because you look at this. When you look at this, you look at the front view. This is a patella right here. Okay. This is a quadricep tendon. Okay, that attaches to the femur bone and attaches right here. Because it's been pulled out of the way to see the deeper part. So that's the patellar surface of the femur bone. What structure is highlighted? First, it's a little bump on the bone. Which bone is it?
Radial tuberosity.
Radial tuberosity. It's a little bump on the radius. That'd be a radial tuberosity. Okay. Because you know the capitulum is right here. You know the radial fossa is right here, where it fits in. And the trochlea is right here. What do you got left? Which bone is highlighted? What's the bone behind the tibia?
Fibula.
Fibula. That would be your fibula. Okay. Which bone is the one that connects the tibia and the fibula to the foot?
Talus.
The talus. Okay. Okay. Remember, the talus bone connects those, and the calcaneus is this big cube, that's your heel bone. What structure is highlighted? And this is we're looking at an anterior portion, yeah, because there's the patella. Look at the anterior portion. So if you're looking at it head on, the blue structure is on what side, the medial or the lateral side?
That'd be the lateral collateral ligament.
Lateral collateral ligament. Yep. And that connects what two bones? The femur and the fibula. The bed, right? Yeah, that's right. Perfect. Which bone is highlighted in the hand? It's this one right there, right in the middle. Let me show you your answers again. Trapezium, capitate, humate, or trapezoid?
Trapezium. Or the trapezoid.
Any guesses?
One of those four.
One of those four. I'm not quite sure what it is. Trapezoid. Nope, it's the capitate. It's the capitate bone. Trapezoid is this one over here next to it. I get the bones of the hand mixed up sometimes. That's your trapezoid. Which bone is highlighted? What is that bone that articulates with the hip bone?
Femur.
That's the femur. That fits in the acetabulum. That's your femur. What structure is highlighted? It's a little bit tricky. It's not referring to the whole space. In other words, if this whole thing was blue, that'd be the acetabulum.
Yeah.
Joint. So it's the kind of lining inside of it.
The synovial membrane.
Synovial membrane. Because the acetabulum and the cartilage would be above those areas. So I would say the synovial membrane. Yep, perfect. That's what contains all the synovial fluid so that joint can flex. Like I said, if this whole thing was blue, this whole circle, that'd be the acetabulum. And the ring on the outside, that's the acetabular labrum. And the articular cartilage is between both sides of those bones. All right, what suture is this? Runs right down the middle between the two parietal bones.
Sagittal suture.
Sagittal suture. Okay. What suture is this?
Coronal.
Not coronal.
Oh.
Lambdoid.
Lambdoid. Lambdoid suture runs between the parietal bones and the occipital bone. And who remembers this point right here? This little point that sticks out.
Greater
Back of the skull. What's that? It's 3 words.
It's like on the tip of my tongue.
It's on the tip of the back of the head.
Is it the external occipital protuberance?
Exuberant.
Perfect. External occipital protuberance. Perfect. That's exactly what it is. All right. Very good. All right. This is looking at the joint here. Here's the patella. So this is the
Medial collateral ligament. Wait,
or in the medial or lateral side.
lateral. That'd be lateral. Wait.
Yeah, looks like the lateral collateral ligament. Because this looks like the lateral side here. Since this looks like the lateral side. This is the medial side. Because this is the patella right here.
We did that one, didn't we?
Probably. No, this has like 50 questions. It goes through them randomly. So you might get a duplicate now and then too.
So it's just a different picture, different angle. Like the
Turkey.
All right, what bone?
Ulna.
How do you know it's the ulna? There's two things,
The thumb is on the opposite side.
right? Opposite side of the thumb, and it's the bigger of the two bones, the longer of the two bones. That's the ulna. Because the radius is always on the same side as the thumb or the phalanx. What structure is highlighted there? That's on the foot, patellar bones here.
And the fibula.
The head of the where we
Fibula.
have the fibula. Okay, that looks good. That's the head of the fibula. Here's a tibia bone, and there's a fibula behind that.
And the malleuses are the ankle notches, the ankle bumps.
Right. Yep, down here. Yep. Now this joint right here is called what? That's the proximal tibia fibular joint. And this joint here is called what?
The distal.
The distal tibia fibular. Oops, my phone's, I should turn that off. Usually have that on silent. Why did I do that? Silent mode's on. Okay. Oops. All right, we're back. And you got that one right. What structure is highlighted?
Capitulum? No. Yeah.
The
Capitulum.
head of the radius?
The head of the radius.
Ah.
Perfect. Now, what's this structure right here?
Capitulum.
That's the capitulum. What's the structure right here?
The trochlea.
Trochlea. There you go. Perfect. And this would be the radial tuberosity right there. The bump on the radius there. Good. Which bone is highlighted here? This is the, let's kind of blow this up a little so you can see it. Okay, this is the bone in the foot where the, I'm going to say the ulna,
Talus.
where the tibia comes down and meets it. This is the what?
Talus.
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 Yep. Perfect. And what structure is highlighted here? First of all, what bone is it on?
Femur.
Femur. What's the really big bump on the femur called?
Greater trochanter? I don't know.
Greater trochanter. Okay, because the lesser trochanter is going to be down here. The neck of the femur, you know, is right here. The head of the femur articulates with the acetabulum with the hip right here. So that has to be the greater trochanter. Okay. Why are the highlighted bones classified as false ribs?
They do not have a
Okay. First one is they do not connect the transit process of the vertebrae. That's false because they connect right here to the transit process of the vertebrae, right? They connect right here to the vertebrae. They do not have a cartilage attachment to the sternum.
That one.
Sounds pretty good to me, right? The other ones say they have no vertebral attachment. No, we give a true here. Then they connect to the sternum only through ligaments. That's not true either. Okay, so that'd be the best answer. Okay, and which ribs are they? Numbers what?
11 and 12.
11 and 12. Okay. They do not have a cartilage attachment to the sternum. That's where they're floating ribs. The highlighted structure attaches to which of the following structures? That is looks like the PCL, posterior cruciate ligament. And it attaches to the medial condyle of the femur, lateral condyle of the tibia. Anybody have a good guess? Anybody think they know it?
Medial condyle of the femur.
Medial condyle of the femur. This goes with the first one, right? Perfect. Very good. As it comes right through the middle here, and that's the posterior cruciate ligament. As it comes and attaches to it and runs down underneath it. Very good. Perfect. Which ligament extends from the highlighted structure to the pubic bone? I don't think we've gone over that yet. That's the iliac crest, anterior
Pubofemoral ligament?
pubofemoral ligament. No, it's the inguinal ligament that attaches to that. Like we haven't covered that yet on the inguinal canal. Look at that in the reproductive system is what ligaments attach there. And one more, the highlighted structure reinforces the knee by connecting which two bones?
The femur and fibula?
Femur
The
and
femur and the fibula. Yeah.
femur and the fibula. Perfect. What's the name of the structure?
LCL? Lateral
No.
collateral ligament?
Was it yeah. I thought you said the ACL. I'm sorry, I didn't hear it. Lateral collateral ligament.